Welcome to Living Vividly, the podcast where health, wellness, and curiosity collide. I'm Jackie, the founder of Vivid Health and Wellness, your guide on this journey to living your happiest and healthiest life. My co-host Daphne, the unconventional dietitian, is always ready to shake things up and bring a fresh perspective to your wellness journey. And we can't forget Dustin, our producer, who keeps everything running smoothly behind the scenes. Together, we'll chat with health and wellness experts along with everyday people who have inspiring stories and practical insights to share. If you're ready to nourish your body, move better, and discover simple ways to thrive, you're in the right place. And hey, if you enjoyed today's conversation, don't forget to leave us a comment sharing your thoughts, and subscribe so you never miss an episode. Today we are joined by Dr. Brennon Kelly with Rise Chiropractic. So excited to have you on.
Great to be here. Long time coming.
I know.
This was like we were going to do this and we pivoted. We're going to do that. And now we're finally.
Yeah, we were supposed to have our health revolution a couple months ago and that didn't happen. What do you think? I mean, it was a scheduling thing, but do you think that people don't view movement and pain as like a sexy topic to talk about?
I don't know. I guess you'd have to, what's it being compared against, That's a really tough question. I think it is, but maybe that's why I'm here, because I'm the only person who thinks it is that's willing to talk about that. I don't know. I don't know. I think the timing of it was funky and...
coming off the heels of Mardi Gras.
Yeah. Maybe people just weren't quite sure where it would go. I know people reached out to me and said, hey, I am planning to go, but it was mostly like other professionals. There was no quote unquote lay people who I knew that were interested in going. So,
well, maybe after this episode, people will be interested enough to dig into this deeper.
Movement, this is just my perspective, and I'm certainly not in the world of movement, but it's been talked about for so long, like you need to move, you need to exercise, you need to be active, like that it is not sexy anymore. And so you have to find a specific way to make it more. I mean, if we talked about pickleball, that would be like a sexy thing, but we're not calling it exercise. You know what I mean?
Right.
I don't think anyone's ever said that sentence.
Pickleball sexy.
Pickleball is very sexy. I have no idea. I don't watch pickleball.
Actually, I think you're spot on, because it reminds me of how we try to market on like social media and stuff, and not like from a paid perspective, like the organic stuff.
Right.
I follow a ton of chiropractors, PTs, like different type of people in the health and movement pain space. Right. And when I see like the same old boring, like do your morning stretches, I'm like, gosh, this is just gouge my eyes out, let's find a way to like spruce this up and make this exciting again, different approach. I went through the Leadership Lafayette program years ago, and I was always like waiting for an opportunity to like share more about what I know. But obviously that wasn't the purpose of it. I just knew that it would lead to those conversations once relationships were made and stuff. But they asked me, I was asked before one of the sessions to lead like a stretching session.
God.
You were so excited, right?
It's just like, gosh, that's what they think. Okay. Yeah. All right. And I'm not trying to say like, I've just like this topic and this work can just go. You can unpack it and go so many places with that. And I'm excited for what our time here is going to be. But I think maybe that's it, is that they probably think I'm going to get up there and teach them how to stretch their back. And like,
it's funny that you say that, because my Peloton stretching instructor has said, this is so embarrassing, that I watch a Peloton stretching instructor, but it's more than just stretching, because their
stuff is good.
He's not a chiropractor, is he?
I don't
know.
No,
he's a Peloton stretching instructor.
He's a Peloton instructor, but he's super hot. That's why I watch him. But anyway, he was saying kind of the same thing. He was talking about stretching and the importance of stretching and why we need to be stretching, but it's not super sexy, and you're not going to see people stretching on Instagram and think that it's cool. So nobody ever talks about it. Nobody ever really stretches the way they're supposed to. So that kind of circles back around to your stretching. But we know that you do way more than just stretch.
Yes, let's get into it.
Okay.
So I understand that your type of chiropractic care is very different. It's more unique than a typical crack your back type thing. So tell us about it.
Yeah, so I use the Gonstead methodology. Gonstead it's named after Clarence Gonstead. He has long since passed, but He was doing such incredible things in the mid 20th century that the majority of the accredited chiropractic colleges were basing their core curriculum technique classes off of his work. So the work is still influencing all of the colleges, whether the students realize it or not. It's the listing system. It's how we measure which way a bone has gone, so you know which way to push it. It's looking at rotation and tilt and all the degrees of change. Like a lot of that stuff that we look at on X-ray and the setups that you do, even in more traditional chiropractic offices where, you know, it may kind of be the same thing on every body, like a general mobilization, but a lot of that stuff was influenced by Gonstead, whether they realize it or not. From what I understand, Gonstead was the first chiropractor to ever even look at or adjust the pelvis. So if you have anyone trying to perform a pelvic type manipulation or adjustment, that is kind of like a watered down version of what Gonstead was doing in 1940s, 50s, 60s, 70s. He passed in 78. They begged him to create a seminar series to basically pass the knowledge down. And, you know, I'm like what they would consider a third or maybe a fourth generation Gonstead practitioner. The technique is dying out because it's not sexy.
So if we're talking about chiropractic care, just in general, we're talking about the spine and the way that the nervous system is encased in the spine. Does that make sense?
Yep.
I mean, am I saying that right?
Yep.
Okay. So if that's the case, everything is realigning and adjusting the way that the spine stands so that it can support the rest of the body. Is that correct?
Yeah. The neuroskeleton essentially controls everything in the body. So if you find a mechanical lesion in one area of the spine.
So what is a mechanical lesion?
A mechanical lesion would be a segment that's not moving correctly.
Okay.
And it's putting stress on the surrounding soft tissues, especially the disc, the spacers between each segment in the spine. And there's so little space for those nerves, those nerve roots to exit the spine and go to all the cells, tissues, muscles, organs of the body. So if you have a lesion there, or essentially a problem, a mechanical problem, that puts stress on that disc, on that nerve, and then you see health issues. So 30% of the nerves roughly are sensory nerves. So that could be like pain, numbness, tingling, burning. The other 60, 70% is going to be autonomic and motor nerves. So you might see somebody who has issues with constipation. Mm-hmm. And then I go in and I'm looking, and I see abnormal temperature readings over the skin at the fifth lumbar. Okay. Swelling or edema or bruising or pimples or tissue changes right over the fifth lumbar. Okay. Pinpoint tenderness. I poke L4, I'm good. I poke L5, whoa, patient's coming out of the chair. Interesting. And then I start tipping them back and forth, and I feel like it just does not tip back very well right there, and it's not moving the way that it's supposed to. Every single segment in the spine and the pelvis, honestly, every joint in the body has a normal expected movement. And we're trained to test that and know what's normal, abnormal. So if you get the abnormal movement there, okay, now we're checking multiple boxes. We've got palpatory changes, visual changes, sensory changes, temperature changes. The temperature that we look at is measuring blood flow to the skin. So the autonomic nervous system controls how much capillary dilation or how much blood is just stored in the surface of the skin. In a state of rest, you see balance and you see good heat going to the skin. If somebody has a major difference, like half a degree or more Celsius, like this side's really hot, this side's kind of cold, that is not normal physiology. So we know that we need to go in and look at that area. So the Gonstead method is just that. It's rather than going in with this checklist, like short leg on the right, turn the head to the right, turn to the left, I'm going to adjust the hip this way. I don't go in with any sort of bias or like preconceived idea of what I'm going to do to this patient. Like I have a whole lot of things I can do, and I kind of put that on the back burner, and I go in like a detective and just start collecting data without judging it. I'm doing temperature readings, I'm doing palpation, I'm asking you questions, I'm looking at the x-rays, and then I'm eventually going to start like honing it down and saying, I think, Jackie, you have issues at C7, T10, and fifth lumbar. But based on what you're complaining of, I won't say,
You could talk about my stuff.
I don't really remember if it was that specifically, but like, let's just use constipation as an example.
That wasn't really one of my symptoms, I'll have you know.
I just get excited when we bring up poop, and that's probably the fastest we've brought up poop on an episode.
So
it's almost in every episode.
Let me come back to that so that I actually finish a thought here, because we need to speak to that for a second.
That'll make me very happy.
Yeah. Okay, well, maybe that's where we go with it. So my family's going to laugh at me so hard. So I go in as a detective, I narrow it down, and I say, okay, well, based on your symptoms, Jackie, and kind of what you're showing me, I think that this is a problem with the parasympathetic nervous system. I think this is a problem with the sympathetic nervous system. So if I adjust here, that upregulates this. If I adjust here, that downregulates. Let me leave this alone intentionally, specifically adjust this segment or these two segments, and watch the trail. I want to see how the physiology of your body actually changes, how the neurology of your body actually changes as a result of that adjustment.
And so are those changes immediate, or is it kind of it takes a few days for
Both.
things to kind of, okay.
Great question. So there's things that we look for immediately, and then things that we look for on a more long-term basis. So if somebody's just crazy inflamed, you're not going to see a huge change in the temperature right away. If it's literally just the nerve that's controlling the blood flow, and that's the only thing causing the heat imbalance, I immediately see a change on that temperature scope. One of the things I like looking at the most is coordination of gait. So if you watch somebody walk up and down the hallway from the front and the back a few times, you're not really like trying to say, oh, that left hip's not moving or that right shoulder's tilted. You're just looking for the coordination of the whole thing. And then immediately following a good adjustment, you'll see much better coordination, smoother, more fluid movement, not as many asymmetries. Like, I'm not swinging the arm on the right more than the left. My heel strike's equal on both sides. I'm not like favoring the left side, dipping on the left side. Like, if you see that immediate change in coordination of gait, you know you did something really good for the central nervous system.
Interesting.
Yeah. So like, that's one example of something I'll look for. But we try to watch the trail. And what I mean by that is you're looking before and after adjustment and at the beginning of every session. So if Jackie comes back 2 days later, 2 weeks later, I'm looking at my notes, what I saw, and then I'm going to look at her before I do anything and see what's different about that day with the temperature, the palpation, the gait, the symptoms, how attentive are they? Like, are they, because when people are in pain, they have a pain face. Mm-hmm. And it's really interesting to see how some of my acute cases, the people who come in like not walking, 2-3 days later or the next week, like, it's a totally different person. Mm-hmm. I've learned to have so much mercy and grace for people coming in like that, because I know what you're doing is not who you really are. And then soon I'm going to figure out who you really are once we get you over this. So yeah.
And so it sounds like what you're doing is, this is through conversations we've had before, what you're doing is very small. Like, you're doing very small shifts or adjustments over a period of time, rather than crack your back and then, expect that we're going to see a lot of change from that.
Yeah, it's a small thing, but don't get the wrong idea. Like, when we set the bone properly,
right,
like, it's a big old kaplunk, but you get the one segment to adjust to the disc, or the pelvic bone to adjust through the SI joint the way you want it to. And sometimes you get in pieces of it, and sometimes you get the whole thing, depending on like if that patient's body is ready or not. Okay. But when you get a really good one, like, we don't need a microphone. Like, I've seen some people, oh yeah, like, you can hear it across the room. And I don't say that to scare people, but you're not going to push the segment any further than it needs to go. It's just that gas release from the joint that makes the sound. I don't base the success of the adjustment off of the sound. I base it off of the feel. So like, I know patient knows if we corrected that, and then we know when they come up, if we see those changes that I'm talking about, if we're at least moving in the right direction. Yeah. But I think in terms of like small versus big, you're not going to get like multiple segments just twisting and cavitating. The majority of what I do with my body and the energy that I'm using on the patient when I'm making an adjustment is actually to stabilize them so that nothing moves that's not supposed to move.
Right.
So like, if I want to just adjust your fifth lumbar, like, I'm getting you in a position where your pelvis is pinned to the table, everything above L5 is not going to twist or move. And we put the pressure in from 3 different points of stabilization so that it kind of, the force we're applying goes right through that segment that we're trying to apply and nowhere else. Now, do I achieve that every single visit? No,
Yeah.
I'm not. And nobody bats 1,000, but that's what we're shooting for every time, is to throw that perfect strike.
So what are the most common reasons that people come in to see you?
Obviously, like the aches and pains.
Like what aches and pains specifically?
Yeah, lower back pain, radiating pain down the legs, sciatic pain, radiating into the arms or the hands, numbness and tingling in the hands. Those are bread and butter things we're really good at fixing. People seem to think that there's an issue with seeing somebody like me if they have like MRI results of a bulged disc or an extruded disc or whatever. We work really well with that stuff.
Okay.
Most of the time the disc is protruding because there's pressure on one part of the disc that's causing it to bulge out. Like think of a water bladder. If you put more pressure on one edge rather than in the center, it kind of pushes out right there. So what we're trying to do is get you to stack this thing over the disc better, like standing on top of the middle of the bladder or the water bed. That's going to cause equal bulging circumferentially, like across the whole disc, rather than all on one side going into the nerve hole. So I can't fix a disc. I'm not removing a disc. I'm not injecting anything into the body. I'm simply making the body stack up better so that it doesn't bulge as much to one side.
Let's say I had a dislocated rib. How would you go about that? I almost called you literally last week.
Oh, that'd have been cool.
Would you have been able to help? Because it eventually released or whatever. I never know if I need to push it back in, or if it's just going to go back in, or if it's already back in and it just hurts because it wiggled out or something.
Okay, yeah. So you make a few good points there. I'd always check you. So, you know, if somebody's questioning, like, can you help me? Can you not help me? If it's with your body, let me check it. You know, like either I'm going to decide I can or I can't, but I'd x-ray it. I'd see what it's doing.
Oh, y'all do x-rays. Okay.
Oh, yeah. So you'll see like if there's more space between the ribs than there should be, especially like where the rib head comes in and meets the spine. So there's ways to analyze that and figure out how to set it. Most of the time, a rib issue is a thoracic spine issue. So the first thing I would do is check the thoracic spine segments where that rib's coming in. If you get that fixed, then the rib takes care of itself 90% of the time or more.
Gotcha.
Every once in a while, I could probably count on two hands how many ribs I adjust a year, like a rib head that's actually displaced.
And
like
won't go back.
up.
Yeah.
And they're very easy to set back in, and it's usually one and done.
Gotcha.
Unless the person just has like a very unique job that puts a strain like on their body to where a rib would keep popping out. If that's popping out continuously, I'd want to like look lower in the spine to say what's not moving right. That's causing you to compensate up here. That makes this thing keep popping.
That sounds good.
But you made a good point that the body heals itself. Like you said, well, sometimes it just goes back in and I'm good the next day. We respect that principle with every single person coming in. So like if I see that the issue is self-limiting, meaning it corrects itself, there's really no reason for me to touch that, I'm not doing anything, because I would much rather your body heal itself than me go in and introduce a force into the body from the outside in that you don't necessarily need, which that's really what the chiropractic philosophy is all about. Chiropractic, as it was founded and the way that it was brought up before things started to kind of change, people trying to progress it and, you know, make it more evidence-based or science-based, which sounds good at the surface, but it can be a trap. It can limit you in practice because you can't think outside the box. You can't apply the art form. But the original philosophy of chiropractic, which I find is kind of being lost today, is that the body is self-healing, self-regulating, and it was by design. God designed the body to heal itself, regulate itself. We respect that power in everything. All we're trying to do is facilitate that, not say, oh, we are going to, you know, manipulate everything and get it fixed. And it's not a car. You can't replace the parts. This part talks to that part. I mean, you guys know about hormones. Like, you just change one little dial on the hormone and the whole panel is going to change, right? It's all interdependent. So I try to bring that philosophy into every single decision I make on a patient. So a lot of times it boils down to an hour of investigation, and then I put them on the table. And to your point, one little, and I'm out. Yeah. And I almost feel a little insecure about it sometimes, that I have to say, yeah, we're really a measure twice, cut once kind of technique, you know, like just so people know, like there's a ton of intention there. And a lot of what we're doing, much like the nervous system, is inhibitory. It's preventing myself from going and doing something that I know I can do that might actually injure or not help the patient, and only doing the thing that I think will help the patient, you know?
Yeah.
Yeah.
Well, on that note, I mean, our bodies are designed to heal themselves. And in a perfect situation, our bodies would function well without chiropractic care. But there's a lot of things that we're doing to mess our bodies up. Do you bring that, like have those conversations with your patients about other things besides just chiropractic care? Do you talk to them about maybe the way they're eating or other lifestyle things that could be contributing to why they're experiencing some of these problems?
I would say even the type of movement, or more likely the lack of movement that they're doing to allow themselves to get into this place.
I mean, we sit a lot.
All of those things are 100% valid, and no factor of health, I believe, is really more important or better than the other one. They all work together for synergy. But they pay me for my time to correct the subluxation. So I do have to use that and say, what I've tried to do though is create like this network. So where if it is something that I think Jade would be better equipped to handle this, like that's what she does, go see her. If Brandon or if Daphne or somebody in the network who does something that I see this patient has a need, like they are a metabolic inflammatory mess. I can't do any chiropractic. It's like pouring a glass of water in a swimming pool. They're wasting their time with me. I'll make that referral or whatever for that patient so that they can attack the highest priority item first. But in terms of conversation, it's easy general stuff that'll help 90% of the time. And if I see it's something that's a higher need, I'll try to refer to somebody who does that. Yeah. Otherwise, I'd be in the room for an hour talking about all kinds of things that aren't chiropractic, and I'd have a waiting room full of people. You know?
So you mentioned the art of chiropractic. Chiropractic? Chiropractic.
Yeah.
Chiropractic care. The art of chiropractic care. Can you explain what you mean by that a little bit more? It would be easy to think that it's just science based.
Right.
It's just neurological. It's just like bone, or maybe even like not physics, mechanical, but there's always an art to everything. So give us the art side of chiropractic care.
Chiropractic is a three-legged stool. It's science, philosophy, and art. If you don't have one of those, then you're missing a piece of the puzzle. So the art component of it is the skill. It's the nuance. It's the a sports analogy, but it's the shooting a free throw. There's a technique to it, there's a method to it, but at the end of the day, there's a touch. You can't just be a robot in there. And my body is different than my partner's body, than my mentor's body. So if I'm watching a mentor who's 6'2" and tall and lanky and much stronger than me try to adjust, and then I try to imitate that, it's not going to work for me. I have to figure out how to make those physics work for my body, and that's where the art comes in. So
it's practice.
Oh,
it sounds like just practicing over and over.
And that's really what Gonstead is. Like, the finding is something that you can do mentally. If you understand the system, which does take time, but you can understand basic biomechanics and you can understand basic compensatory mechanisms of the body. So, when you see a spine rotating to the left and the hip kind of turning in on the left, we know what's going on there. That makes sense. So when something doesn't make sense, that hip's not supposed to be rotated forward on the right side if they're doing this, that's probably the issue. And there's the clue. But the art, in my opinion, is both a decision-making process, but also like the ability to skillfully apply an adjustment. And I think that's why one of the reasons I don't get bored in there is because there's so much room for improvement for being able to deliver a very precise, very skillful adjustment that I'm 8 years in and feel like I'm still way on the front half of my career. Yeah. Like, I unfortunately meet people across lots of industries. They even say this in Christianity. Like, have you ever met someone who's been a Christian for 20 years, but they don't have 20 years of experience? Or like my mentor will say, there's a lot of chiropractors out there who have 25 years of 1 year of experience.
Yeah.
If that makes sense. Like, it's that hunger.
Like the same thing over and over and over.
Like, decided I'm good at year one. Oh, cool. I'm making a little money. I can chill. I can autopilot. That is like not what we're trying to do at all. We're trying to get better every single year, every single week, every single day, to give a more skillful adjustment than we did yesterday. And I honestly believe that 8 years in, night and day difference in what type of adjustment I can deliver now versus back then. Like, the brain just needs 10,000 repetitions with every move to become a master. And I think if you get 100,000, then you're a Jedi. And so I'm trying to go that direction with it, but I got like 20 more years, you know? Yeah.
What made you get into chiropractic care?
I knew I wanted health, medicine, healthcare, something. And I was actually at Millsaps College right out of high school. I was playing football there. I was studying pre-med, and they had these incredible medical school acceptance rates. Like 80% of the kids graduating bio pre-med were getting into med school. So it's like, okay, I want to go there. 2 years in, I decided to come back to UL. I wasn't playing ball anymore. I had a knee injury. Didn't feel like, going back after that, after the whole rehab. And I just had like 3 what I would call divine appointments where these chiropractors just like popped into my life. And I don't have like this awesome testimony of, oh, had debilitating migraines. Chiropractor adjusted my neck once and they were gone. I was miraculously healed. So I wanted to be a chiropractor. I hear that stuff a lot, but for me, it was more boring. It was like, okay, I want to do healthcare, but I see this like more holistic approach. I think that's pretty cool. Let me check it out. So I had shadowed and worked with in the medical field, GPs and specialists. And then I'd also shadowed and worked with chiropractors. And the biggest difference I noticed was the type of patient and the demeanor of the patient. In the medical office, they didn't want to be there. They were sick. They were, whatever. And they weren't oftentimes motivated to really make lifestyle changes to achieve the health that they really, deserved. In the chiropractic office, you have all these self-motivated people who just want something better for themselves, for their kids. They want a healthier pregnancy. They want kids that don't get sick as often. They want all of that stuff. And I was like, that's really cool. Like, I want to work with a population who's vested in better health outcomes. And when people are showing up because they want to, it's a totally different culture in the office. And I just really liked how the chiropractic credo was nothing from the outside in. We're not putting anything into your body that's not already there. And we're not taking anything out of your body that God put there. We're just working with the substance and the power that's already there to make it function at a higher capacity. And I just thought that was so cool. And then you hear the testimonies. Like, I worked with a chiropractor in town, and I was just an assistant at the time, like getting intern hours while I was at UL. And you'd see people like, in debilitating pain, can't walk, suddenly like, no more walker, no more cane. You'd see people who couldn't poop that were pooping again. You'd see like remarkably different labor outcomes in moms who had pregnancy or care through their pregnancy versus their first kid where they didn't have it through the pregnancy. I'm like, okay, that's pretty cool. And there was just so many, like this broad spectrum of benefits. It wasn't like we were just working with headaches or vertigo. It was like headaches and vertigo got better. Back pain got better. Digestion got better. Like ADHD got better. I'm like, wow, this is really cool. And then the more you dig into it, you're like, well, yeah, you're helping the central nervous system function at a higher capacity. It controls everything. So of course, everything does get better, I
think that's what most people don't understand about it. They think it's just about back pain when it's about your nervous system. Yeah. I think that all the benefits that you just named, like ADD, who would have known that could improve? I really want to talk about the digestion. Like,
let's do it.
Constipation. How would adjusting somebody benefit their digestion in any way?
Yeah. So not just constipation, but like blood flow or let's see, all the things that I could think of that would be digestion related. Everything from like gastroparesis, where you've got the vagus nerve that's controlling or not really controlling the emptying of the stomach, to innervating like the gallbladder, the liver, of course, the small intestines, large intestines. Like, let's talk about all that.
Yeah.
Because you also mentioned like the heat and the inflamed whatever. Have you ever seen it help hemorrhoids?
Yeah. In fact, I had one yesterday.
Crazy. You had a hemorrhoid yesterday?
Yeah, me personally. Got adjusted
and it's gone.
No, kidding. No, I had somebody who was struggling with that, and we found a sacral segment that was really inflamed, and we worked on that, and the nerves there go and innervate. Yeah, you look at the dermatome chart, you'll see the
that's cool. That's really cool.
Yeah, I mean, and what that is it's a dilation, or it's tissue that's swollen, like it's a vessel, it's a vein that's backed up, and then it's
telling you something's wrong. basically.
Well, the hemorrhoid specifically.
Right.
I mean, yeah. But hold on, let's not
Yeah, sorry,
get
let's
too
go
deep. So vagus nerve's huge. We could talk about that all day. Definitely don't consider myself a vagus nerve expert by any means.
Yeah.
Talk to Brandon, talk to Jade. But we know that vagal nerve tone is affected by the upper cervical spine and the mechanics up there. So, okay, well, I have a system of analyzing and very specifically correcting occiput, C1, C2, sometimes C3, or even cranial segments, if indicated, to try to facilitate better vagal nerve function or to upregulate parasympathetic nervous system function in general. So if somebody came in and I really suspected a vagus nerve issue where we'd want to see more vagal tone, I would leave alone all of the segments from the 6th cervical, base of the neck, all the way to the 5th lumbar, because every single one of those segments, when adjusted, will create a sympathetic response, a sympathetic upregulation, or in other words, gas pedal, fight or flight, stress. And vagus nerve is parasympathetic, rest and digest. So digest, if you want to see better digestive function, you need to be able to get out of stress mode. So you don't want to tap the gas pedal to those areas. Okay. So you have a green nerve and a yellow nerve going to every single organ, right? Yellow, in my mind, being sympathetic, gas pedal, green being parasympathetic or brake pedal. That's oversimplified. That's the way I talk about it to patients. But this is an interesting example because you're trying to turn up vagus nerve function. But because it's a digestion primarily nerve, you upregulate that by only working C5 or up. Usually C1 atlas is what you're going to see has the biggest influence over vagus nerve. It's usually the rotational component. So the atlas sits on C2 and it kind of like most of the time will ride up the condyles. It'll kind of go anterior superior. And then you'll see laterality where it's either the right or the left side because the joint gets swollen between C1 and C2 on the right, and it lifts up, or the joint gets swollen, C1, C2 on the left, and it rides up on the left. And then it's that last component where it'll either rotate forward or rotate back a little bit on the side where the problem is. And wherever it's rotating forward, that's where it taps that extension of the vagus nerve, which it runs right in front of the atlas transverse process. If you look at like Netter's anatomy, and I mean, a couple of degrees of misalignment there can actually put pressure on it or irritate it and affect its ability to control digestion. Yeah. So that
would be like all the way down because vagus nerve controls pretty much the whole digestive process.
You're hitting a major pathway there. Some chiropractors are upper cervical only because of how important that area is. Mm-hmm. They'll say, you know what? Hell with the rest of the spine. I'm going to put all of my time, effort, and attention into this one area because of how big of an effect it can actually have on the whole body.
And we're talking like here up?
Just this. C1. Yeah.
Okay.
Personally, and this is my opinion, I think you're missing a lot with that. I would like to apply that same level of specificity to every segment in the spine. So that's the Gonstead
But that would
approach.
be over a period of time. I mean, if somebody, and I'm thinking about, obviously, I talk about digestion all day long. So that's my area of concern. But for so many people that have so many challenges with digestion in general, maybe this is the first time that I've ever really considered and thought how much the nervous system, how much adjusting the spine can help with the digestive process. So that's something I probably need to look into a little bit more.
It's a multifaceted thing for sure.
Right.
And then you could dive in and say, okay, well, T5 area is typically major influence to the gallbladder. Okay, well, is the gallbladder struggling? Or, so if I ask questions, I find somebody, oh man, this person's having trouble emulsifying fats. Okay, what's your diet sound, like? Do you have any conditions that I need to know about? Are you taking any medications? No. Why the heck is this person's gallbladder not functioning properly? Oh, there's a huge temperature reading at T5 that's not supposed to be there. And I poke T4 and it feels fine. And I poke T5 and they just about jump out the chair. I'm like, okay.
Well, so most of the time people don't know that their gallbladder's not functioning. They just know that something's not right.
Something's not right.
Something's
My digestion
not right.
is so dysregulated. I'm in pain. I'm whatever.
Yeah. And, when I start asking about questions, I'm like, okay, do you have, is it a dull pain? Is it a shooting pain? Is it a sharp stabbing pain? And they're just like, it just hurts right here.
Yeah.
It just hurts right here. I'm like, okay, is it on the left side? Is it the right side, up or lower? And I mean, obviously I'm not touching them to do anything, but I'm just trying to get a better idea of maybe even the organ that might be causing, the issue. But so many more things I have to ask about now.
We could do a whole deep dive on like digestion alone. Cause I mean, you got the top, the middle, the bottom. There's so many different elements to it. I want to go back to the poop thing.
That'll be the next episode whenever we come and talk just about digestion.
Let's do it. That would be great. So the poop thing, there's a running joke in my family amongst people who are close to me that we're the poop doctors. So my cousin, my first cousin, who's a brother to me, we grew up next door. I mean, our moms are sisters. They run Lafayette Valley Theater. Like we're so tight as a family that he's a brother to me. He's my partner in practice. Also a Gonstead doc, very good at what he does. We've been making poop jokes for a very long time. We were the first boys to come up through the family. Mm-hmm. So you could just about imagine like how shocking this was for my family, you know, and we just took it to the extreme. You know, you give them, you get a little bit of a reaction, you go further, right? So poop was a big thing because nobody wanted us talking about it as bathroom talk, right? Well, I'm 35 and I'm still making poop jokes. So, and it's funny that in practice, we've seen incredible results with constipation specifically, whether it's infants coming in who are having trouble with constipation, failure to thrive, not gaining weight, whatever. And the mom's like, oh my gosh, I don't want to put them on formula or, we can help with that. Or just adults, general wellness. There's a ton of reasons why somebody may not poop. And that's a whole episode, right? I think the low-hanging fruit is that lower lumbar nerve innervation to the colon and to the rectum. So if you have a chute that can't open because the smooth muscle tone is too contracted because there's too much innervation or not enough innervation, then you have to figure out how to release that pressure. So if the nerve is not controlling this right, and so it's just too tight, they'll be constipated, they'll become compacted. And so you want to adjust usually the sacrum or sometimes the fifth lumbar, which will allow it to relax and it'll open it back up. It's like basically hitting the reset button on that valve. And people oftentimes, like I have several patients where they know that when they go to get adjusted, they are going to have to poop before they leave the office. So like they plan for that. And it's a joke. So I just think it's so funny that the jokes from childhood transferred into the career and my family has a ball with it. So they call us the poop doctors.
I'm going to title this The Poop Doctor.
Do it. Clickbait. Get people is maybe not sexier than
that's true.
pain, but definitely, clickbait.
More fun.
Definitely.
Yeah. I'm called the shit talker in my family.
Okay.
Because for the same reason.
Yeah. So maybe not the low hanging fruit, but like the next step, just to kind of like peer into what that conversation would sound like, is you'll see some people who it's not a nerve control thing necessarily, but it's a physical kink. So I'm sure Jade and them talked a lot about the myofascial system and how that wraps through the whole body. And so if you have tension in the body, especially rotation of the pelvis. So if I have one side that's externally flared and stuck, or one side that's internally flared and it's stuck that way, like it won't open back up, and that's what I would be looking to correct, what you'll see is that there's all this connection in the fascial system to that pelvis part of the skeleton into the digestive tract that's going through there, into the uterus, into like a lot of those abdominal organs, where some of the issues that people have, it's actually because of that mechanical tension or torsion that's being put through the body. And so when you release that, it's almost like allows the tract to just sit the way it's supposed to. And so things can pass through it easier. So sometimes it's not like a nerve control thing. L2, there's part of the ascending colon that's, paralyzed to an extent. So you're not getting that peristalsis the whole way through. It's like a toothpaste where you skip and you start again, so there's the nerve control, but then there's also the kink where somebody's pelvis is rotated. It's just putting mechanical stress or torsion. And so the uterus is kind of the same issue. Sometimes you'll see like a toxic uterus type of condition. You have a ton of women struggling with reproductive health. PCOS is rampant, endometriosis, fertility struggles, the whole thing. And if the uterus is not able to contract well and contract symmetrically, then you're not going to be able to slough off all the tissue. You leave 10% behind, 5% behind. That, eventually over the years, it's like a cup that just keeps filling and overflows. And now you got PCOS, endometriosis, whatever. And so, and then you'll have women who are just sick, and then they get this hysterectomy and it's like, a miracle. Right. They're like alive again. And they needed that. But I wonder if there was a way to get ahead of that whole thing and allow the process to just fully eliminate to where the cup never overflowed in the first place?
Right.
What if that sort of situation could have been prevented? So a couple of examples that I've just sort of thrown off, off the cuff, that chiropractic should be a proactive wellness strategy. The same way y'all take your supplements in the morning, you're not necessarily taking your magnesium or your B vitamin, your multivitamin complex to treat a symptom.
Right.
You're doing it because you know it's supplying the body with the raw substance or whatever that it needs in order to just keep healthy function. That's a proactive strategy, right? As opposed to, gosh, I have a headache, I need to react to that and take a Tylenol today. You're not even getting to that point because you're working on the front end. That's what I believe chiropractic should be. Pain relief is like the easy, get them in the door, back pain, come see me.
Right.
But what I want to teach them through our process, and that's kind of what Rise stands for, is how do we get you ahead of the 8 ball? I don't want you in acute pain episodes once a year. I want you learning how to treat your body and what those daily strategies are so that you can stay ahead of it. And that's why we have a big wellness practice too. Like I love the pain stuff and we do really well with that, but I like it when people convert into making it just a part of their routine and they're coming in and I haven't heard them complain about pain for 2 years. I might see them once a month.
Obviously, when someone's in pain, and this is what happens to me, nobody else can help me, so I'm coming to see you. I mean, if somebody's in pain and they have back pain and they are not going to go the more medical route, they're going to come chiropractic. You see a lot of those. How much of your population would you say you're seeing as the preventive measure?
I used to actually have a bigger wellness practice.
Okay.
I have less wellness now in year 8 than I did in year 3 or 4.
Interesting.
I think it's because I've gotten a lot better at fixing things. So naturally I kind of attract the acute, broken, hurting, whatever.
Right.
And I have a little bit less energy to preach these days.
Wellness is a great term.
Yeah.
Preventive is a really great term and theory, but in reality, most people we're reactive to wellness and health in general. We don't decide that it's time to do something until there's been some kind of pivotal moment that says, either with myself, I've got this problem, or so-and-so was just diagnosed with something. So now let me, spend a few minutes taking care of myself now. And then we kind of fall back into our typical practices. So that's not incredibly surprising to me, but I am interested in hearing more of what your wellness side, is the wellness side of it, them coming and saying, I don't have pain, but check everything and make sure that I'm doing okay?
Yeah. Okay. So it's a cultural phenomenon, not just in the Western world, but also the Southern United States.
Right.
Like if it ain't broke, don't fix it. It's definitely a reactive mindset. And I've accepted the reality of that to a degree to where the practice has shifted more to, maybe it's 50-50 to answer the question. Maybe it's 60-40, something like that.
Yeah.
But the wellness side looks like, let's do a thermal image. Let's do a postural screen. Let's run the meter down your back and see if there's any abnormal temperature readings. Let me palpate or poke every single segment in the spine or pelvis. And if it's tender, like, why is that tender? You're not supposed to be tender if I poke your elbow. It's just a bony process. Same thing with the spinous processes of the spine or the PSS and the pelvis. If you poke it, it's just a bone. It shouldn't be tender. So if it is tender, then there's one of two things happening. Either the nerve is irritated, and so the slightest bit of stimulus creates a big stimulus. So that's an inappropriate nerve response, or there's inflammation there. It shouldn't be. Why is it inflamed? Are you fighting something off? Are you stressed? Are you a metabolic mess? Are you subluxated right there? Meaning like, do you have a subluxation there? Is L5 not moving the way it's supposed to?
What is subluxation?
Subluxation that's what I was talking about earlier. That's what we're trying to fix. So when we see that abnormal movement of the one segment that puts stress on the disc that irritates the nerve, that's what we call a subluxation.
Okay.
It's a medical term that just means less than a dislocation. Sub, less, lux, out.
So I had surgery on my shoulder and they said it used to sublex.
Yeah, so basically they're saying it's coming out of socket, but it's not full dislocation. Chiropractors actually define it differently.
Okay.
And maybe not every chiropractor adheres to this, but this is how I was taught, and this is the philosophy leg of the chiropractic stool, which if you don't have the philosophy, you don't have the why. Everybody has a philosophy of practice. So when we put it on paper, body self-healing, self-regulating, doesn't need anything from the outside in, God equipped it, facilitate it. So lux, if you look at I don't know if that's a Greek root, whatever it is.
We'll just call it the root.
Lux actually means light. So whenever you break it down, it's less light condition, a condition of less light within the body. When I think light, I think action potential, nerve propagating signal in the form of light or electricity. From brain to body, body to brain, brain to body. So I'm like, oh, now I really like this subluxation word because it actually means less power in the body. And there's this, chiropractors say this so often that it's kind of like cheesy now, so I don't like saying it. But the first couple times I heard it, I really liked it. But some chiropractors will say like, the power's on. After they get adjusted, I'm like, oh, they're saying that again. But it's true, because if you're restoring the power to the body through that, by removing that interference to the nervous system, then whatever's at the end of that nerve has more light, has more power, and will function better. That's a holistic approach. So if I go poke that L5 and it's tender and swollen and there's edema and it's red and there's a pimple, I've talked about pimples.
Yeah, because I had pimples around the little area that I was messed up.
Tissue change. Then I'm like, that needs to be corrected. Did you have any pain? No, I didn't even notice it. Cool. We're catching it before it. Pain's the last thing to show up. 10, 15 years and now somebody's got back pain because it's that cup overflows again. It's that same concept where if you just dump the cup out once a month, it never overflows in the first place. That's the wellness model. But people, they have to have a certain personality, a certain budget, a certain, lifestyle in order to, so I know what my ideal client is there. And if they fit that profile or don't fit that profile, I'm not trying to make people who don't want that for their life. So you can't want it more
force
than
it
they
on
do.
them. Yeah,
exactly. So I try to meet people where they're at as best as I can.
So how many times, if you're seeing someone, I know this is a question you're not really going to be able to answer, but I'm going to set you up to.
You probably know you can't answer that question about your practice. You're like, let me ask him what he thinks.
If somebody's coming in and they have maybe like a chronic pain, so I'll use my husband as an example. My husband's oftentimes he is crooked. I know he's crooked. The other day I was walking behind and I was like, there is an obvious difference between his shoulder height. This cannot be right. I know there is something significantly wrong here, but he's not walking around in pain. However, there are times whenever he sneezes and all of a sudden he can't move, he can't move for 2 days, 3 days. He's literally laid up on the couch, or in bed, really can't really do anything. And then it kind of, fixes itself and goes away, but it's just a matter of time before this happens again. So if he were to come into you in that time, whenever he is in pain, is it like a series of, I'll see you every Tuesday, Thursday, I'll see you once a week, I'll see you in 2 months? Like, is there any way that you can answer that?
There's no formula.
It just totally depends on what is actually happening and what you can adjust at the time.
We literally go visit to visit. I won't say day to day, because sometimes in those cases you see them twice in a day.
Yeah.
It is literally visit to visit with that. And so the goal being you drop the frequency in half until there's 50% improvement subjectively. So if he cannot walk and he's saying 10 out of 10 pain, well, if after the third visit he's walking better, like halfway better, and he says I'm like a 5, a 6 out of 10, cool. Now we're going once a day, or we're going twice a week. So that's the goal, is to get them. The goal there when they come in like that, just so you have something to latch on to, is get them to once a week as quickly as possible. Okay. If he's in that state, he's not gonna. We'll be able to accomplish so little at the first visit because of how inflamed it is, that he's only going to make it to that afternoon or the next day. He's not going to make it to next week. Right. So that's how we judge that. And then once somebody's more stable, then we can predict better. I mean, you're either going to do them once a week, twice a week, or every other week. Like there's not that much variation to it. So once I find the sweet spot for that person, I set it until something changes, until they tell me there's a different need, or they think they can go less, and then we evaluate that. But what is the sweet spot? It's not finding 7 areas of inflammation when we run up their spine, not finding, all of this restriction. They can turn their head 80 degrees to the right and 60 degrees to the left. Like, it's when those things start to become more symmetrical. There's no complaints. The thermal readings are pretty chill for the most part, aside from maybe one little thing here or one little thing there. That's a person who's much more stable. And then we drop the frequency to something more predictable every other week, once a month. And then, the person's occupation is big on that, their lifestyle. I got people who do motocross, all this wrestling, jiu-jitsu. I'm like, okay, once a week. Yeah. And then I got people who just have sedentary jobs, but they stay active in, you know, in their health and wellness routine. And they're just like, they're really stable and they don't have issues. I'll go every 2 months or something like that with a few of them. But that's pretty much the spectrum of wellness. Yep.
Yeah, that same thing happened to his brother like 2 weeks ago. His brother called me. He's like, I need you to take me to the chiropractor.
It's not genetic.
I can't move.
It's not genetic.
Oh,
My dad
they have
had
lots
back
of
issues.
room for improvement for a lot of things.
Sure.
But
In those episodes, like if I could preach for a second, every single episode is a little bit more damage on the disc. Don't wait till the next episode to go see about it. If you're between episodes right now and you've had an acute back before, go get it looked at because it's a ticking time bomb. If you didn't have it fixed, then it's still out. The disc is just not swollen. And then you're going to move and stress and move and stress. And then finally the straw breaks the camel's back. People don't come in because they deadlifted. And they come in because they picked up a sock or a toothbrush or, you know what I mean? It's
that's what happens to him every time.
Yep. So it's that disc just finally reaching the fail point. And every time it fails, the fibers tear a little bit more. So you want to get the mechanics there corrected as quickly as possible. And it's easier to do it if they're not in acute pain. Like the acute pain thing, you kind of have to nurse them and baby them to where they get to the point where they can tolerate the correction at all. You know, sometimes you just pump. You're just on the segment. You know it's this one. You want to put, but you can't. The body won't let it yet. It's too guarded. So you just simply pump with their breath. And then finally, if they can take about 50 pounds, you're like, okay, I know you could tolerate the adjustment. And then you can give the adjustment. But yeah, if you're between episodes, get it fixed.
That's the time
now.
to go.
Believe it or not, irony, I have a really bad back. So some of it is I have a pretty malformed sacrum and a very short right leg. So I'm currently in this experimentation of engineering a lift on just the right side at a certain degree and a certain height to try to level off the pelvis. And I've been shooting x-rays to try to figure that out. And we have this pretty nice posture technology where you could take pictures from all, every direction and put all the dots and it'll tell you like the angles and everything. So we found the thing that works for me and I'm trying to get that installed so that I can hopefully not have as many episodes throughout the year. Cause it got to a point where I could get adjusted and it would help, but I could never hold the adjustment because of that structural deficiency. So what is the real root cause of what I'm finding? I try not to stop at just what I'm seeing, but to think about it like, Daphne, you keep having this L5 every single time you come in here. I see you every other week.
Yeah.
What are you doing?
Something's wrong.
How are you sitting? How are you sleeping? How are you? And then, you go through this whole checklist and then you find out that, I look at the x-ray and on the full spine view from the front, you have a hip socket that's significantly lower on the right side. Okay, well, why? That doesn't just mean you have a short leg. Like maybe the pelvis is torquing a certain way that's causing it to sort of like ride up or down and that's creating it. Okay, let's fix the pelvis. No, you're actually going forward on that side and turning in. That should lengthen it up, but you're still lower there. That's a structural deficiency. Hang on, let me stick a couple of my complimentary exam cards that we hand out to new people under your heel. And oh, wow, how's that feel? I actually had an episode a few weeks back and it was my mid back. And ever since picking up one of my babies a couple years ago, I felt the mid back. I was out for a couple of days. I'm like, mid back? This is such a weird, usually it's the neck or the low back. Never had a mid back episode before. So I was like, oh goodness. So here we go. So I'm working through that. Whenever we put like 10 millimeters of cardstock under my right heel, before I even got adjusted, all of the pressure came off the nerve in my mid back.
Whoa.
I'm like, this isn't a mid back problem. My symptoms are in the mid back, but the root cause is the structural imbalance on the lower right. I need my right pelvis adjusted. I need my heel lifted up on the right side.
Yeah.
I don't even chasing pain is really narrow-minded, is short-sighted. And sometimes you can actually make the patient worse. I've made this mistake where I thought, oh, neck pain, adjust the neck. Oh, that didn't go well. Those were the early years where you figured out oh, this actually comes from this, and then I have to tell the patients that because they're like, doc, are you going to adjust my neck today? I'm like, I adjusted your neck today. Didn't touch it. I adjusted your hip. Your neck's connected to your mid back, which is connected to your, remember that song from childhood, right? Yeah. This is what's, they have this really cool model I saw in a video one time. I think they call it like a tensegrity model. You've seen this before? It's an architecture thing, right? But God designed it first. So yeah. So basically you look at the scalp, somebody made a model where they have like these bungee or these tension cords that connect where like all the little muscles in the spine connect. And what they'll do is they'll take just like the right hemipelvis and like rock it forward. And you'll literally see how the whole spine all the way up to the cranium changes. Like, whoa, okay. That's a different model. This is extremely complex. When I saw that, I was in school at the time. I was like, I need to have way more respect for this thing that's on my table than just, crack, pull the head, like all this stuff on Instagram that's getting all the views. Not my vibe. I'm like, why is it doing this? All right, down here. Oh, you're not supposed to do that. What happens when I push it this way? My mid-back feels better. Oh, okay, cool. Set it. And then, just after the hip adjustment, they get up and they're like, my mid-back pain is gone. I'm like, cool. Like, you're not going to adjust my mid-back? No. See you later.
Yeah. Why would you?
Yeah. Less is more. If you do the right thing, I never get desensitized to how profound the body reacts or improves to the right adjustment. I don't find that miracle magic button every single time.
Yeah.
But, a couple times a week we'll get like a really good one on somebody and I'm like, that was cool. Write me a 5-star Google review.
Yeah.
Want to do a testimony real quick? Yeah.
Hey, where's your wallet right now?
Where's my wallet? Not in my pocket.
Okay. That's what I was going to ask. So is that, how bad of a thing is your wallet in your back
Pretty
pocket?
bad.
Yeah.
Yeah.
Because you hear that sometimes.
Weird on your butt. Like it lifts up a...
Yeah.
So kind of what you're talking about with the shift.
Almost every guy.
Yeah.
I mean, we could do... You're kind of already doing it. Well, you're both already kind of doing it.
Yeah, I sit like a...
That's what I'm like,
we're good.
My pelvis is all messed up.
Yeah. But those little... Those are the questions I would ask somebody if I'm like, why does this left pelvis keep showing up? I know we got a good adjustment on it last time. Do I need to check your feet? Like, is that where it's coming from? Oh, you how do you sit? Like, I find a lot of women who like to sit.
I sit all kind of jacked up.
Leg underneath. Yeah. And I'm like, what I like to ask is, okay, so you like to put the right leg underneath like that? Yeah. I'm like, try putting the left leg under. And they're like, oh, I can't. Yeah, it doesn't work. I'm like, it's because your hips are off. Like, if you are turned this way, then when you go, you can go that way. And it feels good to go that way. What you can't do is go back the other way. And so when you try to do that on the other side, it doesn't work. I'm like, those types of things or habits that you're doing are probably creating the issue. So you just got to get off the couch. This is the subluxator right here. The couch.
Sitting.
Oh, yeah. Like I'll tell all my pregnant patients this, but really it goes for everybody. And I try to practice it too. Not doing it right now. We need to work on
we have different
next
chairs.
studio. But
we'll have you come approve our new chairs.
Ideally, as a rule of thumb for anyone, we needed some value added, right? If you are sitting for an extended period of time, you do not want your knees above your hips. Because look, all of your weight goes into your spine and my spine's in a curved or a flexed position. That's not how it's designed to hold weight. Like your pelvis is designed to hold weight. There's a tripod between the two sit bones or the ischial tuberosities, the lowest part of the pelvis, and the coccyx. And really it's the two ischial tubes or the sit bones that hold like 80-90% of the weight. The coccyx is just kind of like a kickstand. Yeah, balance. So if you're not even on the tubes and you're rocked back, you're just kind of like putting weight over a general whole sacral lumbar area, and it's all going into the discs of your spine. Like I'm hurting right now. That was a good idea, by the way, with the pillow, because I'd be hurting more. But ideally,
I should have gone into chiropractic care.
Yeah, if I demonstrated the right way to sit, Dustin would smack me because I'd have to move the microphone out of the way. But yeah, you want the knees kind of like angling down. It doesn't have to be excessive, but just like 5 degrees lower than where the hips are at. For pregnancy specifically, that kind of rocks the pelvis forward and brings the belly out in front instead of baby's weight and everything going into their spine and their sacrum.
So if we're sitting at like a desk, because let's face it, I spend a lot of time sitting at a desk. Yeah. I just need to make sure that the height of the chair is high enough to let my knees, my legs are pretty short. So my most important thing is that I want to make sure that my feet are touching the ground. So, but the height of the chair needs to be high enough so that my knees can be lower than my hips.
Well, it's not even necessarily the height of your chair.
It's just a slant.
Because because my chair at my house does that too. So like if like my feet can be however low, but the knees still up because of the seat.
Okay.
But like if this was more forward, it'd be better than back and up and like tucked.
Okay.
Yeah, I think so. Yeah, I mean you can apply the concept to a million different chairs.
Yeah.
I don't have like a chair I would recommend.
Yeah.
Just do the opposite.
I'm
of
just
a bucket
thinking because
seat.
my office is moving and I'm going to be getting a new chair. So I need to
get
the right chair.
yoga ball.
A yoga ball. I've tried that before,
You
but
might
my
get tired.
my height it doesn't work with my height.
Okay, yeah.
Because then I'm like typing like this.
Yeah, and it's a little unstable. You probably fatigue quicker. So if you're doing it for 15 minutes, great. But if you're working for an hour, 2 hours, you do need like a good solid structure. You just want it in a position where your pelvis is not rocking backwards.
I have to pay attention.
Yeah.
Is standing better than sitting?
I think alternating is what you should do.
Okay.
Yeah, because if you stand too long, then your postural muscles will fatigue and you'll switch from relying on the active system to the passive system. So the active system is the muscles contracting and holding you there. Well, if the muscles get tired, then the passive system, the bones, discs, ligaments, that's going to hold it. Even if it does it long enough, that's when things start to get stressed out. So switching allows you to not fatigue so that you don't have to rely on the passive system too much.
Gotcha.
So not just our chairs, but do you think our shoes affect?
Oh my gosh. Yes. Get somebody who's an expert to talk about dexterity of the feet, how children shouldn't be wearing shoes, or at least wide toe box, wide open, zero drop. Like all of that stuff is ideal. But as we age, or if we've been wearing heels too long, or if we had an injury, or if we had surgery, pins, plates, Achilles
Flat
rupture, the game changes, and you have to support it properly. It's not the same tissue anymore. So some people do need a Brooks, a Hoka, something with 4 or 5 millimeters or 10 millimeters of heel lift, depending on what's going on. I mentioned my issue. I need something specific on the right side versus the left. The idea is as barefoot as possible, unless your body can't tolerate it. Some people just can't do that, and it creates more problems because of how they have to compensate. So I would try to match it to the person and go as barefoot as I can.
I like that response because you see all those. I see videos all the time that are like, the more barefoot you can be, the better it is for your body, the better it is for everything. I'm like, it definitely depends.
There's no one size fits all. Yeah. There's no 10 sizes that fits all.
Right.
Again, that's why Gonstead is so amazing, because you walk in and it's a totally targeted, unique adjustment to that person. I adjust your L5 totally different than I adjust your L5. And you might need Atlas adjusted today and never again. She might need Atlas adjusted every time I see it. Like it's exactly what that person needs based off of objective indicators. That's why I gravitated to the work. Like I was exposed to 30 something techniques in school, and there's hundreds, honestly, but within the curriculum and the what's the word? Electives. Like I took a bunch of stuff, and then eventually I was halfway through and I was like, everybody's saying different things. This chiropractor does this. This guy disagrees with that guy, does something different. And I'm like, I'm so confused. Like, can we just do this based on real, repeatable, objective indicators? And that's when the Gonstead system saved me, because I don't know if I would be able to be, now this is just me, not saying that the other techniques aren't great. I'm saying me personally, my brain, my personality type, I don't think that I could work in this chiropractic field if it weren't for Gonstead methodology. It keeps me grounded, it keeps me sane, it gives me a system, and it allows me to be effective and not second guess everything I'm doing and just do whatever on every person. So they've estimated that we only know, like, all the medical knowledge we have, all the textbooks, all the research, they estimate that it's about 5% of all of the interworkings of the body. And we don't know. We're working with very limited information. So to come at somebody and say, you need a surgery, I'm like, how do you know? I'm like, what?
That's where I'm confused. Like, nobody should really disagree. You should be open to figure it out.
Try the concern first, right? So you and I might both be very intelligent and know a lot about the body. And you go and you look at this extremely complex organism and say, I think it's actually coming from here. And I'm like, I think I disagree, Dustin. I think it's actually what's happening here that's causing that. And the only way to know is
let's look at it. Yeah, let's figure it out.
Yeah, because if you adjust L5 and you get him better, and I adjusted C1 and I didn't get him better, well, then you were right. What's really interesting and what they're researching right now, this is the cutting edge research in chiropractic. It's brain research, actually. So what they can't figure out is, and there's a lot of hubris and little man syndrome in my profession. So there's a lot of big voices at each other's throats. What they're trying to figure out is why you adjusted the fifth lumbar on that patient and they got better, and why I adjusted the C1 on that patient and he also got better. And I'm like, well, if it's the fifth lumbar and you got him better, then it's the fifth lumbar, right? But I didn't adjust. I adjusted the C1 and I got the same result.
So somehow they're either connected or
Yeah. And then there's instrument assisted techniques. You've seen chiropractors with clickies, right? Clicky, clicky. Great. It's not my technique. I'm like a bone, move the bone, set it kind of guy. I just need that from, whatever. But that's the kind of care I would like as a patient. So that's what I try to replicate. But in more affluent regions, back when chiropractic was in its infancy, those lighter force techniques was what they were using. The bone setting, kind of barbaric type techniques was what they used in like rural areas. Like Gonstead was in a town, Mount Horeb, Wisconsin, town of 4,600 people, world renowned clinic. I mean, just in Dairy Farm, Wisconsin, but these people didn't go to a doctor unless they were dying. So the people he saw mostly were people who were like kind of on their way out physically and physiologically. So it's just depending on what those early chiropractors were doing, it kind of dictated what the technique was going to be. But it all works to a degree if you have an actual technique. So to me, it's not like, well, should I see a Gonstead chiropractor or should I see an upper cervical chiropractor? Or should I see a Thompson or an activator, or what technique do I need to see? I'm like,
don't complicate it any more than it
just
already is.
Go see somebody who's helping you. And if they're not helping you, go. Like I've heard stories of people who go to a chiropractor for 30 years and they never got better. I'm like, how did they?
Plumber.
Yeah, I always say, if you call a plumber, if your toilet's overflowing and you call a plumber and the plumber is a super nice guy or gal, but they don't fix the overflowing toilet, then you call a different plumber. You don't keep going to the same person.
Do you see this in your field too?
All the time.
Right?
All the time.
It's interesting. So yeah. So back to the point I was trying to make is, this lady named Heidi Havik, Haavik, very fascinating work. She has books written for lay people too. So she's not just like this brain, like she's a great communicator as well. She's a neuroscientist and a DC, a chiropractor. And she's out of New Zealand. She runs some of the highest level research that we have in our field right now. And it's all about how the specific adjustment changes the brain. So what you're seeing is you're seeing a stimulus go into the cerebral cortex. That's actually what changes the anatomy of the brain and then changes how it sends signals back. So it would
make sense that if you adjust, that it's not just going from where the adjustment is out, that it's going both ways.
You're firing an afferent nerve signal back up to the brain. You're firing
That's not how I would say it, but yeah.
So it's a loop, right? There's information that goes into the computer, the computer processes, and then it sends information back out. That's how our bodies work. Computers are great. God designed it first though. So it goes up, and then that stimulus actually changes the anatomy of the brain. So you've heard nerves that wire together. You'll see larger axons. So the axon is the cord, the extension cord. The nerve itself, its extension cord gets larger in diameter, and it creates more extension cords. So it's a bundle of larger cords, and that's a stronger signal so that the body can reproduce that. So like muscle memory, for example, the reason a professional bowler can get up there with his eyes closed and roll a 250, but I'm trying so hard and can't, is because I don't have that same physical nerve wiring he does. It's a tissue. It's not just like a metaphysical thing. When you adjust the spine specifically, meaning you're not just creating a stress response, but actually firing a certain nerve tract up to the brain, you'll see the brain's anatomy change. Wow. And that's all they know at this point, scientifically speaking, fact. What they don't know and what they're trying to figure out moving forward is, okay, with that information, what do we do? What's the best way to use that to help people?
Right.
So hopefully I see that answered in my lifetime, but that is because of how complex it is, the tensegrity, we don't know if we'll figure that out anytime soon. Yeah.
We are so unique, and I think this humility goes a long way. And I think as providers, it's good to know that you don't know everything. And we as patients should be okay with that. And I think this going to someone who does something different than another provider, that's a good thing. Like we're all coming at it from different angles, and going to someone who's okay with not having all the answers and knowing everything is a good thing, and be willing to learn and just be humble.
I tell people sometimes, like, we're going to explore this together, because I'm not sure I have all the answers. In fact, I'm pretty sure I don't have the answers because I'm not living in your body.
I think a lot of people are afraid to be wrong about something or look stupid when it's better to admit that you are still learning something or not.
Yeah.
You don't have all
I
the
was like
answers.
that early on. And then now I'm like, I don't know. Let's see if we can figure it out.
It helps build trust.
Yeah, absolutely. I realized that I was afraid I would lose people's confidence in me, which was just insecurity in the beginning. And that's changed over the course, where when you actually admit that you don't know something, you gain their trust so much more, so that later when I say no, it's this. Not only do they believe that and trust that, but I can communicate with more confidence because I wouldn't say that otherwise.
Right.
Like, I know I can stand my ground on this one. You don't need that back surgery. Let me look at this. And they're like, oh, okay. You really straightened up for that one. Yeah. So I think that it goes a long way to really admit what you don't know.
Yeah.
Because I've come across providers that are just cocky buttheads that act like they know everything, and turns out they're nincompoops.
You have to be that way in school, unfortunately. Like, I'm not saying they don't have things to work on, but I think it breeds that a little bit, practitioners, because like the type of OSCE testing we have to go through, you kind of have to like exude a level of confidence in those objective testing scenarios. You're so nervous. You'd get so nervous for this stuff that the way I would pass is I would compartmentalize and go to this place almost pretending that I was more confident and knew more than what I actually knew. And if they asked me something I knew and I performed it well, I crushed the test.
Yeah.
And I think that's it. They ask so much of you in the medical curriculum that in the chiropractic curriculum, it's the same thing. Like, we go through 4 years, it's basic in the beginning, clinical in the end, and you have to pass all these tests and these boards along the way that you get calloused to this test taking environment. And then if school taught you how to pass the test, and you didn't do anything else in school to learn how to practice the way you wanted to, no matter what type of health care you practice, then you're going to come out doing what you were trained to do. And that's maybe why it looks that way, because that's kind of how we maybe train people to be. I don't know. I may be speaking
I think there's a lot of personality in it too. I mean, a lot of personality in the fact that some people are just overconfident.
Yeah.
And that's just part of their personality.
Yeah. Well, before we let you go, we're going to have you on, obviously, again, because there's so much more that we can dig into and we don't have enough time. But we ask everybody what living vividly means to them.
Vivid. Okay. So let me admit what I don't know, right? Let's define the word vivid, because that's an interesting question. Vivid means like in color, full spectrum, sharp appearance, full of life, maybe.
Full of light, maybe.
Full of light, maybe. Living vividly. I think that it means that you're very intentional with everything you do. Like, I don't think we were designed to just go on autopilot every day. I think that we're supposed to be very intentional with the decisions we're making, whether it's how we raise our kids, the books we read, what time we go to bed, our lifestyle habits, how we practice, or how we take care of our bodies. Like, everything should be for a reason. And if you realize that there's this whole area of your life where something's just on autopilot, your health perhaps, maybe we take a look at it and audit it and say, what do we like about this? What do we not like about this? Can we do something a little bit differently, change the routine, and potentially get better results, or results that we didn't even know we could get? I can't tell you how often a patient's like, gosh, I didn't realize how bad I felt until I started feeling good again, right? So yeah, living vividly to me just means being intentional with what you're doing.
Thanks for listening to Living Vividly. If you enjoyed today's episode, please leave us a review and subscribe. We'd love to hear from you. For more resources and details from today's discussion, check out the show notes. Until next time, keep living vividly.